Everybody knows diabetic retinopathy is a complication of diabetes. That is why the term diabetic retinopathy. It cannot be separated. It is linked together. This diabetic retinopathy may not happen, it will not happen without diabetes. So, it is the child of diabetes. But what happens, once retinopathy is happening, there will be some pathological changes in the ophthalmic system, especially on the retina, vascularity of retina. So, that retinopathy, if the retinopathy has already developed, some changes has already happened on the vascularity of the vascular system of the retina of the eye. And then if the diabetes is already controlled, these changes may not be controlled. What happened is already happened. That is the thing. Mainly sometimes what happens, many patients are unaware of this fact. They believe if diabetes is under control, this also should be under control. Not like that. Some changes already happened in the vessels of the eye. We cannot say it has not happened. The texture has changed, the bleeding has already happened. So, it is remaining. So, even though diabetes is under control, the pathology of this eye problem, ophthalmic issues, what happens, that may develop, it will increase again. That is one thing. And second thing, if the diabetes is increasing in between this problem will also increase, because the trigger factor is coming again. So, just like this management of diabetes, we have to manage the complaints of retinopathy also. Because as far as diabetes is existing, possibility of developing retinopathy also is there. So, we have to manage both side by side. Here we are not managing diabetes. It is another section, and it cannot be mixed with this. Diabetes should be under control by its own experts, and retinopathy should be controlled by an ophthalmologist, because the symptoms of these or the problems of retinopathy cannot be controlled by a diabetologist, and the problems of diabetes cannot be controlled by an ophthalmologist, because these problems is not restricted to eye only in diabetes. It may get complications, may develop some complications in other systems also, kidney or brain or heart or peripheral nerves, like that. In such situations, concerned specialists are handling such cases. Actually, it is the responsibility of a diabetologist to treat the diabetic in such a way that complications will not develop. That is an important point. And why a particular patient is having a problem in the eye is a complication of diabetes, that is another point. There should be some weakness or some delicacy in that system of that particular patient. It may be because of the body constitution, or because of these professional factors, or dietary factors, or other habitual factors like that. If there is some lenience, some probable factors in that particular person, then the complication will be affecting that particular structure. If some another person is having some lenience or some basic factors or delicacy or some weakness of kidney, that patient may be having that type of complication. That means that diabetic patients may develop different complications. That depends on various factors, mainly the body constitution, and second is dietary factors, third is professional other career related factors. So, it is the responsibility of each specialized doctors to give necessary advice or directions or medicine to protect that structure, so that complications may not give some serious problems in that patients. In the retinopathy patients, according to theory, we can say pitta also comes into the picture. The vitiating factor will be pitta. So, we have to control the vitiation of pitta in that particular patients. It will be by dietary factors and by other so many things. So, it is our responsibility to give them necessary advice to control this pitta vitiation, so that his vascularity of the retina can be protected. Like that goes. It does not mean that the diabetic patient may not have complication. We can avoid the complication of some complication in his ophthalmic system by giving that type of directions. If that patient is already having some delicacy or some weakness in that system, that is very important. It is very difficult to handle also, not an easy thing. Expertise and experience is absolutely necessary. Then only we can give that type of instructions.